Hi, everyone. Welcome. My name is Dana Howarth. I'm the program director for the New Mexico Caregivers Coalition. This is our guest presentation with Samantha Morales from Senior Medicare Patrol on Medicare coverage of durable Medicare equipment. For those of you that are new, the New Mexico Caregivers Coalition was started in 2009 to provide a voice for family caregivers and paid professional home care workers and care workers across the state of New Mexico. So just a little bit of housekeeping for today's presentation. Try to keep yourselves on mute. It kind of helps limit the background noise for the recording, especially. If you have any questions during today's presentation, feel free to drop them in the chat. Samantha always does the Q&A at the end of her presentation, so feel free to write them in case you don't want to miss out or forget what your question was. To note, we are running live transcription on this presentation today, so if you need that, you'll need to go to the More button menu and your screen at the bottom of your screen and turn on the subtitles if you're not already seeing it. If you don't want them, don't worry, you can leave them off, but they're there for anyone that wants to have them running. Before I go on to our guest presentation, I want to do a quick introduction of Valerie Sosi, one of our contractors who's helping us recruit for our training. So Valerie, you want to say a quick word?
Hi guys, yeah, I'm glad you guys made it. And you're enjoying this nice cold weather today with our amazing presenter, Samantha. Make sure you guys ask any questions. This is your time. But if you really want to get into it, just remember there's going to be a one-on-one. So you can get with them and her, and you can ask even more detailed questions, which is, beneficial for you. So without further ado.
All right, thank you, Valerie. So as I mentioned, our guest presenter today is Samantha Morales. She's the director of the Senior Medicare Patrol Program at the state of New Mexico. As the SMP director, Samantha leads a team of committed advocates working to assist Medicare beneficiaries and their families to better understand their healthcare benefits, rights, and protections. So thank you, Samantha, so much for joining us, and we're glad to have you again for another Medicare presentation. And thank you, welcome.
Thank you so much. And let me know if my audio cuts out. I trust Dana and Valerie will let me know if all of a sudden my audio is out. My internet seems to be stable, but please let me know. And also please feel free to chat in, or Dana or Valerie to pause me if I'm going too quickly, because I do have a tendency of speaking a little bit quickly. So with that, I am going to share my screen and pull up the slides for today's presentation. Hopefully you can see. Oops, that's my research there. Hopefully you can see my screen here. Give me one moment. I'm going to start from the beginning. Can you see that okay? Fabulous. Okay. So good afternoon, everyone. Thank you for attending this training focused on Medicare's coverage of durable medical equipment, also known as DME. Many thanks again to Dana and the New Mexico Caregivers Coalition for having me today and providing me this opportunity to present on what I think can be a very complicated topic and a very important one, of course, for Medicare beneficiaries who are living with a disability. In terms of today's training, we will focus on the following. So we're going to review the definition of what durable medical equipment is, what Medicare considers durable medical equipment, including prosthetics and orthotics, for example, and the acronym used in the Medicare world is DME-POS, POS. We're going to review the Medicare eligibility requirements for DME. We're going to review fraud and DME, and we're going to review a case study just to put everything in context, hopefully at the end. I always like to start with kind of the mission of the program that I help to manage at the Aging and Disability Resource Center, because it is a program that many people don't know of, and I want to make sure that you leave the training knowing some of the resources that are free and accessible to you through the state of New Mexico. So the Senior Medicare Patrol, or SMP program, is federally funded through the Administration for Community Living, ACL, the feds. The SMP program, our mission is stated in this slide. So as Dana mentioned, so the SMP program, we are there to empower and assist Medicare beneficiaries, their families, and of course, caregivers like you who are working or caring for family members who have Medicare and either are living with a disability and et cetera. So we are there to help people prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, community outreach, which we've had to pivot and reinvent during, of course, the pandemic that's still unfolding. So we're doing a lot of our outreach and community education through our wonderful partners like New Mexico Caregivers Coalition and other partnerships in the community to try to reach folks, even though we're doing it over Zoom. And we also do one-on-one counseling, of course, and we have other types of educational forums and materials that we can mail out to folks who request them for free. All of our services are completely free, of course. So it's also important to put DME, durable medical equipment, in context within the Medicare program. So I always also like to take a step back and just start with a little bit of review of what the Medicare program is. So as you all know, as many of you may know, Medicare is the federal health insurance program created in 1965 for people ages 65 and older, and some people with disabilities who are under the age of 65, and a few others, folks that, for example, are diagnosed with end-stage renal disease, and other folks who are diagnosed with ALS or Lou Gehrig's disease. The Medicare program, it is important to note, was not designed to cover, unfortunately, 100% of medical bills. So that is important to keep in mind. Even though people who are enrolled in the Medicare program have pretty much comprehensive health insurance that you'll see in the next slide, kind of what the structure of the program is composed of, it is important to keep in mind that Medicare pays 80% on an approved claim, and then the remaining 20% is the person's responsibility. So if the person doesn't have a secondary health insurance, like retiree coverage through like the state of New Mexico, for example, or Medicaid, the person is beholden to that 20% cost. The last point I always like to emphasize, because it is telling how many Medicare beneficiaries are dependent on the Medicare program for health insurance coverage. It's a huge percentage of our population in the US. It's an extremely robust and important program. It covers over 61 million people. And this data comes from the 2019 Trustees Report, Medicare Trustees Report, that's published every year, pretty much using previous year's data. So this coming report, we'll be able to see how much the program has grown, right? And the breakdown of that is also interesting to note. 52.6 million people are ages 65 and older, according to this 2019 data. 8.7 million people are those living with a disability. So the program is incredibly important in our country. In terms of the different parts of the Medicare program, we have this structure here in this kind of map, I guess, as you can see it. When we think of original Medicare, the federal government program, the traditional program, the red, white, and blue card that Medicare beneficiaries receive in the mail when they first become eligible for Medicare and they enroll, you'll see that the program is composed of Part A, which is hospital insurance, right? That's the part of Medicare that will cover when a person has a hospitalization, when they have an operation and they have an inpatient stay and they have to stay several nights admitted inpatient. So that's the part of Medicare that's going to pay out. Then you'll have Part B medical insurance, which is essentially outpatient care, right? That's the part of Medicare that will cover things like preventive services, or it will cover things like emergency room care, doctor's visits, specialist visits. Those are the Part B, both programs together create comprehensive health insurance for a Medicare beneficiary. So Part A and B, that's the original Medicare program. That's what people get, right, when they first are in Medicare. That's the red, white, and blue original Medicare card. Now, in the media, often the language we hear is Part C, Oh, we'll get your Part C. Well, what is Part C, right? Part C is really just another way of saying Medicare Advantage plans. Medicare Advantage plans are not an extra benefit, right? They're the alternative way that people can receive their Medicare benefits. People can either stick with the original Medicare program using the red, white, and blue card when they go see a new doctor, or they can say, you know what, I'm interested in getting a Medicare Advantage plan through a managed care plan to cover all of my Medicare needs, my Parts A, my Part B, and my drug coverage, which I'm going to get into in just a minute. So Part C is just another way that people can choose to receive their Medicare benefits. We've heard about these plans in the commercial insurance world, right? There's many different companies that have products that are Medicare Advantage plan. You've heard of them through Humana, Blue Cross Blue Shield, United Healthcare, for example. There's so many of them on the market. It could be quite overwhelming for Medicare beneficiaries to choose the right one for them, right? But that's essentially what it is. It's not an extra benefit that people can get. It's just an alternative way that people can choose to receive their Medicare benefits. Now, Part D, as in David, is prescription drug coverage, outpatient prescription drug coverage. That's the part of Medicare that will pay out when people have a prescription and they take it to a local pharmacy. Now, for people to get Part D, they have to choose to enroll in a private plan that only covers Part D medications, right? If they need drug coverage, they have to kind of take action, find the right plan that will meet their needs when it comes to their prescription drug needs. They could get it either through a Medicare Advantage plan that includes drug coverage, or they can get it through a standalone prescription drug plan through Part D that only covers Part D. So those are pretty much the options, kind of in a nutshell, that people are faced with when they're new to the program. Now, the note at the bottom, Medicare Supplemental Insurance, Medigap, is not part of the original Medicare program, right? So what I mean by that there is that the red, white, and blue card does not come with a secondary health insurance coverage called a Medicare supplement. That's just a different product. That's a secondary health insurance that only functions with original Medicare for people who could afford it, right? These plans can really help to pay the 20% after Medicare pays 80%, but people would have to pay for it an extra premium a month to get a Medicare supplement or a Medigap. It can be extremely comprehensive health insurance coverage. It's probably the most flexible type of comprehensive health insurance that people can have when they have original Medicare and a Medicare supplement as a secondary, and then a drug plan as a third type of insurance. But for many people, it's difficult to afford, because these Medigap plans that cover the 20% after Medicare pays 80%, they can run anywhere from $100 a month to over $200 a month. It just depends. So for many people, that the Medigap is not an option. But I just wanted to kind of lay it out in the map of what Medicare looks like before we kind of delve in to all things durable medical equipment, prosthetics, orthotics, and supplies, DME post coverage, right? So let's kind of delve into the definition. So what does Medicare consider durable medical equipment, DME? So here we provide a summary of Medicare's definition in this slide. So it's a good, let's just say it's a good rule of thumb when we're thinking about how Medicare is looking at a medical equipment item, and if they consider it durable medical equipment, right? So first, I'm just going to walk through the slide here. DME has to be, it's a reusable equipment needed to treat an illness or injury or to improve the functioning of what Medicare rules refer to as a malformed body part. It includes an array of different items. I mean, that goes without saying. Medicare usually covers DME if the equipment meets the 4 criteria listed here. So it has to be durable, meaning it can withstand repeated use, right? It has to serve a medical purpose primarily. So it can't be for like convenience, what Medicare considers convenience. It has to be specifically for a medical diagnosis. It's appropriate for the use in the home. So even though the person may be able to use it outside of the home, like a wheelchair, it still has to be used for the person's ability to move around in their home. The fourth item is also very important. It's likely to last for 3 or more years. So that, in a nutshell, is kind of the lens that Medicare uses to determine whether an item is classified as durable medical equipment. So just thinking through that. So keep in mind that there are some medical items and supplies that do not meet this general rule, and yet we know Part B covers them. So for example, we have to put a separate bucket for diabetic supplies, right? Because such as testing strips, we know those are covered by Medicare under Part B. So already that is important to keep in mind. There are some items that still meet the criteria for DME. They're in like their own special classification. And so diabetic supplies are one that I just want to mention there. And there are others that may be covered by Medicare under the durable medical equipment, prosthetics, orthotics, and supplies category, which we're going to get into in the next slide. So there's other things that may be covered, even though they don't meet these 4 criteria, but under certain conditions, under the POS of DME POS, they may be covered. So without kind of getting too complicated, I just wanted to kind of break it down in this slide, and then we're going to delve into, well, what is the POS and DME, right? So here we have the other piece of Medicare's coverage of medical supplies, the coverage of prosthetics, orthotics, and supplies. So just to walk through the slide, so under the durable medical equipment, prosthetics, orthotics, and supplies category, Medicare Part B coverage includes, and it's not limited to, just the items listed on this slide. So prosthetic devices that replace all or part of an internal or bodily organ, as we list in the slide, prosthetics like artificial limbs, legs, arms, and eyes, orthotics like rigid or semi-rigid leg, arm, back, and neck braces, and then certain medical supplies. And I did want to pose an example of what we mean by certain medical supplies. Catheters, for example, are covered under urological supplies under Medicare Part B, but they're under the POS category. And that's important to keep in mind for certain people who need that type of medical supply because of their diagnoses, and they have documentation from their provider. Those folks may be able to get catheters, for example, under the DME POS category. So I just wanted to kind of separate the two and how Medicare functions to cover these very important supplies for people that need them. So what items are considered durable medical equipment, right? So here we have just a list. Medicare, this is a list that comes from Medicare.gov. I should mention it's not an exhaustive list. And I would like to note a few things. So not all of these items must, it's important to note that all of these items must be appropriate for use in the home and must primarily be used to address a medical condition, right? The term medical necessity here in the Medicare world applies to DME, right? As with all things covered with Medicare. So for Medicare to cover a DME item, people must have a medical need and must meet the eligibility requirements in order for Medicare to cover that medical equipment as DME. So these are just, again, a few examples listed here. You can see, I mean, some of the very expensive items are listed at the top, like the manual wheelchairs, the power wheelchairs, power mobility devices such as scooters, walkers, cranes, canes, etc. Those things are covered as DME for people who need that type of item because of medical necessity, right? They can show documentation from their provider that they need that type of item. And as I mentioned in the previous slide, so I would like to point out that diabetic supplies, as I mentioned before, including blood sugar meters, lancet devices, and lancets, like the strips, right, are covered as DME under Part B. So these items can often be purchased at local pharmacies, right? We see them at pharmacies. However, Here's what's important. People with Medicare, especially in original Medicare, right? They will have to go to pharmacies that can bill Part B of Medicare for these diabetic supplies. That's important. For people in Medicare Advantage plan, they really should follow the rules about in-network providers, about where to go to get their diabetic supplies. But I just wanted to kind of add that other layer that it matters where people go to get their supplies, right? Including diabetic supplies and other things that are considered durable medical equipment. It matters in original Medicare and it matters in Medicare Advantage plans as well. So what is not considered durable medical equipment? So unfortunately, there is a long list of that as well. So the items that are not considered, the items that are considered primarily for convenience rather than for medical use, right? Those that are not appropriate for use in the home, for example, or that are disposable. Those items are not considered durable medical equipment. So here, this list comes from Medicare as well. So bathtub lifts, even though those may be incredibly important for some Medicare beneficiaries in order to not slip and fall in the bathtub, these are not considered DME items, right? Which means Medicare is not going to cover them under Part B because they're considered for convenience rather than for medical use. The same with bathtub seats, bed lifters, bed side rails, those are not going to be covered by Medicare, right? They may be covered by Medicaid or some other type of secondary health insurance, but it's not going to be the Medicare program. Now, the beds, this is, keep in mind that it's oscillating beds here. That's the operative word here. It's beds are covered as DME, but it's the specific beds like oscillating beds. These are institutional equipment that are not appropriate for use in the home. So sometimes people need a specific type of item, a bed, because of their medical condition that their doctors can give them a prescription for. Those types of beds that can be used in the home may be covered if the person meets the Medicare eligibility requirements and their doctor provides them that documentation and they go to the right supplier. But oscillating beds are for institutions. And so therefore Medicare says we don't cover that under B. So that's, I wanted to make that point there. Of course, dehumidifiers, again, this is not covered. Elastic stockings, unfortunately, are not covered. Face masks, which matter right now during a pandemic, those are not covered as DME, right? This idea that they're disposable, right? Catheters. Now, this is the caveat, as I've mentioned with catheters. They may be covered as a prosthetic for people who have the medical condition and the need, right? This would be covered as part of the urological supplies that I was talking about. So even though it's not considered in the DME category, it could be considered in the POS category for Medicare coverage. So that is something that I wanted to kind of highlight as well. So in terms of how durable medical equipment and prosthetics, it's orthotics and supplies are covered, there are a few things to keep in mind. So in this slide, we kind of break down Medicare coverage of DME POS. And you will note that the person's situation matters here. So as you'll find with all things Medicare, the devil is in the details, including with DME. So I'm just going to walk through the slide because there's a lot of information that I think is important. So the first thing is, in terms of how DME POS is covered, right? Now, in general, for people who are not institutionalized, people who are not in a hospital, and who are not in a skilled nursing facility receiving therapy services, in general, they're going to be dealing with Part B if they need a durable medical equipment or prosthetic item, right? They're going to have to go through the Part B coverage. So Part B covers DME POS items for people who meet the eligibility criteria, regardless of whether the person has original Medicare or a Medicare Advantage plan, right? People have a right to receive durable medical equipment items or prosthetics, orthotics, or supplies if they have a medical need, regardless of the type of Medicare coverage that they have. So right there, that's an important point that I wanted to highlight. Now, keep in mind that if people have private plans, like a Medicare Advantage plan, the plans can impose their own rules and cost sharing structure, right, for these types of items. So people really have to follow their plan's rules. Now, the second half of the slide there, I included a note about Part A coverage of DME POS items for people who are eligible, right? So who are those people that are eligible? Well, people who are in an inpatient stay. They are admitted inpatient. The person is formally admitted inpatient either in a hospital or in a skilled nursing facility. So think of the person who may have had major surgery in a hospital, and they've been kind of admitted in the hospital setting inpatient for a number of days, and then they get discharged. And in order to be discharged safely, they need to use a wheelchair. And so the hospital gets that together for the person. They issue them a wheelchair that they can use in their home. That's going to be part of the Part A coverage of that person's inpatient stay. It's the same as in a skilled nursing facility. Maybe the person is recovering, they're receiving physical therapy services, and they need some kind of walker, a cane, etc. That is an item that is durable medical equipment. Then the person, again, that's going to be Part A covering the durable medical equipment item under that bundled service. When they pay the skilled nursing facility, Medicare will include as part of the payment the durable medical equipment item. And so just a special note at the bottom there, just to explain what that is. So in order for Part A to cover it, again, during a person's inpatient stay, wherever they are, whether they're in a hospital or skilled nursing facility, the item must be part of a care plan authorized by the attending physician, right? The attending doctor. And it's usually paid for as part, again, a bundled payment made to the SNF or the hospital for the stay. So you can see, like, in terms of how durable medical equipment items and prosthetics are covered, it depends on where the person is, right? The person's situation matters. If the person is home, it's going to be Part B. If the person is institutionalized, it's going to be Part A. So in this section, we kind of delve into the costs and eligibility requirements for DME POS. So here, just a few notes here. We have the general rule of thumb when thinking about Medicare coverage of DME items and the eligibility requirements that people need to meet to access these items. So in the next slide, we'll delve into the specifics of these main requirements. But for now, I kind of just want to walk through the slide. So for Medicare to cover DME items, the Medicare beneficiary must, number one, have the support of a trusted physician, such as a primary care physician. That's essential. Without the support of a doctor, there is no way that Medicare would cover a durable medical equipment item. So often the first step is communicating with the primary care physician about the medical need and about what type of item would be appropriate for that person. Step number two, right? Have a medical need for a covered item that is primarily used in the home. So again, that is essential. If there is no medical need, if the person just wants a scooter just because they want a scooter, Medicare will likely not cover that item if the person doesn't have a medical need for that scooter. So it can't just be for convenience. The last point is also extremely important. People can't just willy-nilly go wherever they want and expect Medicare to pay for it when they purchase a durable medical equipment item. They really have to go to the right supplier. And the right supplier, and that really is the operative word there, means a Medicare approved supplier. And people will save the most money if they go to suppliers, again, that accept Medicare's payments, right, in full. They're Medicare approved suppliers, are certified to sell that item. Their products are good products, right? Medicare has certified them to sell that particular item. So that's essential. So to protect the Medicare beneficiary and to ensure that they're getting the right quality product that they need for their medical condition.
Hey, Samantha, are you still on slide 9 or have you moved? Because
I have moved. Oh no, are you not seeing
the slides aren't moving, just FYI.
How weird. Let me take a step back and let me go Slide 9. Thank you for stopping me. Let me do that again. Let me share again and hopefully, yeah, somehow my screen looks a little strange here. Sorry about that. Are you seeing my slides at all?
You're still stuck on slide 9.
Sorry about that. Let me see if I can troubleshoot this. One second. I can't even enlarge my screen anymore. It's like,
Maybe
Maybe
stop the
push it.
share and then reshare it.
I'm trying to do that, Dana, but somehow it's not allowing me to. I can't even enlarge the Zoom.
Oh, there it goes.
Oh, am I back on?
It let me stop your share, so maybe now it'll let you reshare.
Okay, great. My
So
computer
now
being
this is
strange.
your
I
quiz
apologize.
time. Can somebody recap plan B for us?
I know, right?
Just kidding.
I do have a case study, but I was saving that till the end. But somehow I'm like, give me just another couple of seconds and see if my computer will allow me. Dana, I wonder if I may have to get out and come back in.
That's fine.
I was hoping not to do that, but somehow I'm having trouble. So I will come back in. I apologize, everyone, because I can't even see the Zoom anymore. I can't see you all. So I'm clearly having trouble with my computer, but let me try and close some of the links that I have open that I wanted to share, but it's very strange. Hasn't happened yet. And we've done a few of these. Yeah, so I think the best thing for everyone, I'm just going to take a 3-minute break. Sit tight, everyone. I'm going to try and get back in as quickly as possible. And Dana, I'm just going to close this Zoom window and then come back in.
Okay.
Thank you. Actually, it looks like I can't even get out. Dana, can you kick me out?
Yeah, hold on.
Thank you. Sorry about that.
Well, I guess while they're doing that, everybody can just take a nice stretch. You're sitting there, you can look to your left. Just get that nice stretch in your neck. And you guys can look to your right. I don't know how many Zooms you guys had, but your first exercise, you look up. You're gonna look down. And we'll just do some small circles to your right. 2, 3, 4, 5, and then we'll go reverse. 1, 2, 3, 4, 5. And then maybe just do a little shoulders to the ceiling or to the sky. Go and get those up to your ears. We hold a lot of tension in our shoulders. You just hold it up there for 3, 2, 1, release. Just get a nice little shoulder stretch there while we're waiting. Oh, it's Samantha's back. Okay, that was quick.
Yay, I'm back. Hopefully this will work. And Dana, I think I am unable to share. It says host disabled participant sharing screen. Oh, there we go. Now I'm able to share. Thank you. See if this will work. Okay, let me go full from the current slide. Is that, can you see that?
We see number 9.
Can you see number 10?
10, yes.
Okay, fabulous. Okay, so I think I was in slide number 14. Hopefully,
wow.
folks, I know, I was sorry about that. But everybody, I should mention this is a good opportunity to mention in terms of material. Dana has the slides in printer-friendly format. So
yes, they were emailed out about an hour before class.
Thank
so
you.
Everyone
Dana.
should have them. If for some reason you didn't get them, just let me or Valerie know and we can resend it.
Wonderful. Yeah, and so I'm not going to rehash everything I said. You can see the slides for themselves. It's just a list of what's not considered DME here. And I kind of gave a little bit more information about the beds, for example, specifically oscillating beds. I'm going to move on to slide number 11. Again, the complexity of how Medicare covers durable medical equipment and prosthetics, orthotics, and supplies. It really depends on the person's situation. So if the person is not institutionalized and they're in their home, it's going to be Part B. If they are institutionalized and they're in the hospital setting or they're in a skilled nursing facility, it's going to be Part A. So you can kind of read a little bit more details into that, but that's what I was covering. And I'm moving on. Hopefully you can see number 12 that kind of delves into the next section. Perfect. And then this one here, I was just kind of, this slide just gives you a good rule of thumb about the eligibility requirements. It's actually, if you think about it, it's surprisingly simple how Medicare views, you know, whether a person is eligible for a durable medical equipment item. And so I mentioned that it's essential for the person to have the support of a doctor, their trusted physician, you know, because they're going to need a prescription from the doctor. And of course, they have to have a medical need for the item, and they have to go to the right type of supplier. So that just means going to a Medicare approved durable medical equipment supplier, right? Finding one in their community where they can go, not just the person down the street that may sell durable medical equipment items, but we don't know if they're certified. So that's important. And here I kind of broke down, this is the slide where I was on, I think, slide number 14. So in this slide, we kind of just break down the fundamental steps that a person with Medicare needs to take to access an item they need, right? So it pretty much comes down to, again, number one, just speaking with their doctor, like literally having in one of their visits with their doctor, if they feel like they have a need for a walker, a cane, a wheelchair, they really need to speak to that primary care physician or a trusted physician who knows and can attest to their medical condition. Then it's the complete, having a face-to-face meeting with that physician is going to be important. Something that I did want to mention is during COVID, during the pandemic, people can satisfy that face-to-face requirement for durable medical equipment item during a telehealth visit. So they don't have to be physically in the doctor's office. They just have to have, you know, a visit with the doctor that is, you know, about the durable medical equipment item to kind of evaluate their condition, and so that the doctor can walk them through. And then of course, the third step is essential, right? The doctor is going to have to write an order, a prescription, a certification about the medical necessity for that durable medical equipment item. And there are specific things that that document has to include. And so that is important to keep in mind. So the doctor, again, and the visit, this prescription, it has to be, as it's noted in the slide, it must take place no more than 6 months before the order, prescription, or certification is written. So time is of the essence, right? It's almost like all the ducks have to be in, you know, whatever that saying goes, they all have to be in a row. People have to check all of those boxes so that they can access the item that they need. The last thing of course, is once they have that prescription, they've met with their doctor, they know what they need to go to the right supplier to get that item. And that's going to be going to, if the person has original Medicare, they need to go to a Medicare approved durable medical equipment supplier. Medicare.gov has a useful tool that people can use online to find suppliers in their zip code area. For people who can't navigate the internet, or they may have unstable internet, or maybe they just want assistance finding a local supplier, they can call Medicare for sure. Or you can call the Aging and Disability Resource Center where I work, and we can have a SHIP counselor, a state health insurance assistance, staff member provide assistance as well. But certainly Medicare is also equipped to provide people with a list of their durable medical equipment suppliers. For people who have Medicare Advantage plans, the last bullet point there, of course, they have to follow their plan's rules. So that's important to keep in mind. So hopefully you can still see my slide moving. We're in slide 15. Let me know if you can't. So for some DME items, the right kind of supplier means going to a Medicare approved and competitive bid supplier, right? So here we kind of unpack what Medicare's competitive bid program is all about. So it's essentially like competitive bid. One thing to keep in mind before we kind of walk through the slide, competitive bid was created to combat fraud, right? Medicare fraud. Because essentially what Medicare is saying is you can go not just to a Medicare approved supplier for some items, but you have to go to a competitive bid supplier that has gone through our competitive bid program. And so just to walk through the slide, so suppliers who submit in terms of what competitive bid is, right? So it affects how Medicare pays for specific items in specific regions. So suppliers have to submit a bid to provide certain items and supplies to people with Medicare who live in that area or who are visiting in that area, right? In competitive bid zones. So Medicare uses these bids to set the amount that they're going to pay for each item. So that is number one. So all suppliers who are participating are thoroughly screened to ensure that they meet Medicare requirements so that they have eligibility, financial, quality, and accreditation standards, right? Before they're awarded contracts. So that's what's important. Medicare is trying to kind of guide people in terms of where they can go so that they can save money, and of course the Medicare program can as well, so that they're not dealing with suppliers that are going to hike up prices for some items that can be very expensive. So again, this is an effort to combat DME fraud. This program only affects people who are using the red, white, and blue card, so original Medicare. People who are in Medicare Advantage plans don't have to deal or worry about competitive bid, right? Am I in a competitive bid zone? What is the item I need a competitive bid item? Those are questions for people in original Medicare. So what is the current competitive bid program? You can see it on this slide. So first it started this year, January 1 of 2021. There are only 2 items that are competitive bid items right now. The off-the-shelf back and knee braces. Big surprise, right? These are the items that our SMP program for the state has been seeing as a major DME fraud issue, where Medicare beneficiaries were being sent, knee braces, back braces to their homes because their Medicare numbers were compromised. So Medicare is trying to crack down on some of these illegal practices that are often fraud related, really. So people who need these items, back braces or knee braces, and who live in a competitive bid area, right? Because there's specific zip code areas that are affected, they will have to go to specific contract suppliers to purchase their knee braces and back braces. If they don't, if they just pick them up wherever they want or call a number on the television to get a knee brace or a back brace, Medicare is not going to pay for it. The person is stuck with the bill. So just keep that in mind. Now, in New Mexico, the only location that is a competitive bid location that people have to worry about is Albuquerque. So Albuquerque is included in the 2021 competitive bidding program. So in our state, we only have one locality, and that is the city of Albuquerque. that is dealing with competitive bid, right? So people in Albuquerque, in the zip codes in Albuquerque, if they need a back brace or a knee brace, they have to go to a competitive bid supplier. So I just wanted to give that overview. And now in terms of what the costs are for competitive bid, and hopefully you can see slide number 16. Is that a, hopefully, oh, perfect, wonderful. So the breakdown, no, this is specific for people in original Medicare, people using the red, white, and blue card, right? So if you have the red, white, and blue card, or if the person that you're caring for has a red, white, and blue card, and they're using that to go see the doctor, they're going to be dealing with the original Medicare 80%, 20% cost sharing for durable medical equipment items. So that's where Medicare will pay 80% on an approved claim for a DME item after the person meets the Part B yearly deductible, right? Which I forget what that is, but it's over $100, I think, this year, the Part B deductible that people meet usually in the beginning of the year. So this means that the Medicare beneficiary has to deal with the 20% coinsurance left over. That's what the person is going to be, the cost associated with that DME item. Now, the second bullet point there is very important. So the costs often depend on whether the person needs to rent or purchase the durable medical equipment item. So for example, some durable medical equipment items, such as oxygen equipment, which can be very complex in terms of how, where just the structure of oxygen equipment, how Medicare pays for it, because it can be rented and they have rental fees. So there's a bit of a different cost sharing structure there. And there's some rules that apply that I'm not going to get into in this training, but I just wanted to highlight that. Sometimes costs will depend on whether it's a rental item or whether the person can purchase it, right? Usually the more expensive items are rented first before ownership transfers over to the person, which means Medicare is paying the supplier a rental fee for the Medicare beneficiary. So you can think of wheelchairs as another item that can be very expensive with a rental. Now the second piece to the slides there, to this slide, people can save the most money by going to approved suppliers, right? So that's really important that people look on Medicare's website, call the ADRC if they need assistance, or call Medicare to find the supplier that will provide quality equipment need, right? That's really important. Otherwise, there could be some very, let's just say, unscrupulous suppliers that can hike up the price. And so you don't want to risk Medicare not paying for something if people, and also the person, why should the person pay more when there are suppliers that are Medicare certified, Medicare approved, that can provide that specific medical equipment item. Now, for people enrolled in Medicare Advantage plans, they just have to follow the plan's rules. So this means going to the network supplier, right? Who's in the network that they can go to. That's going to be the plan. The plan representatives should be able to provide that guidance to let people know where they can go to get the specific durable medical equipment item they need. So at this point in slide number 17, hopefully you see a closer look at power wheelchairs. I did want to highlight power wheelchairs because they're probably one of the most expensive items, durable medical equipment items that people, who have a medical need kind of will have to face just an added layer, right? And that's prior authorization. So in general, original Medicare really doesn't utilize prior authorizations like the private plans do, like Medicare Advantage plans, but this is one item where they do. They do use prior authorization. And I should say not all models of power wheelchairs, but many of them will include a prior authorization requirement. So what does this look like? So I'm just going to walk through the slide here. So in addition to satisfying other DME requirements, such as the in-person visit with the doctor, for example, getting a prescription, power wheelchairs, again, they may have an additional step where the supplier, where the person goes, has to request prior authorization from Medicare first, right? there's that piece. So that either the doctor has to do it or the supplier, depending on where the person is going. So if the prior authorization is required for that model power wheelchair, I'm just going to walk through the second half of the slide. Again, the provider or supplier must send the prior authorization request to the durable medical equipment Medicare administrative contractor, the DME MAC. Okay, so this is without complicating things, I just want to give you more language that Medicare uses, right? This is kind of like the alphabet soup from Medicare that I want to make sure that you're aware of, because the DME MAC is the entity that Medicare contracts to adjudicate, to review and process the claims for DME for each region. So each state is under a specific contractor. Now in our state, the DME MAC is actually a company called CGS Administrators LLC. Now this is just, just for your information. You don't have to write this down. You may not need this, but CGS is the DME MAC that will review DME claims for our state, right? So this is what suppliers are dealing with. They're dealing with CGS, right? And so once just to walk through the bottom half of this of the slide, the DME MAC, once they receive that prior authorization, they're going to respond within 10 days, or it could be sooner if the person's medical condition requires, an immediate response. So if the DME MAC approves, the supplier will provide the equipment to the individual, and the person will owe the normal Medicare cost sharing, right? The deductibles and co-insurances, or depending on what the situation is, if there's a rental fee involved that Medicare has to cover. Now, if the DME MAC denies prior authorization for a power wheelchair, the provider or supplier can request the authorization just one more time, right? Giving more reasons for why the person needs the power wheelchair or the scooter, for example. So if the person is denied again, at that point, it's really after 2 denials from the DME MAC, it's really unlikely that Medicare will even pay for a power mobility device like a power wheelchair. So you can see it's a little bit for power mobility devices like scooters or wheelchairs. It can be it's that added layer of the prior authorization, that added hurdle that could be a challenge for people. So it's very important for the doctor to make sure that the doctor is sending the right documentation to the supplier so that, the DME MAC receives the appropriate information. Now, people can reach out. The public, we do not have access to the DME MAC. Like I can't just call CGS and say, hey, what's going on with my clients, prior authorization request for a power wheelchair. They won't talk to us. They won't talk to the public. Believe me, I've actually tried. They will only talk to providers, doctors who have license numbers, and they will only talk to suppliers. So the supplier, if they're having trouble, if something's going on with the prior authorization, they don't know what to do, that's where, as an advocate, I would tell the supplier or the doctor, can you call CGS to find out what's going on? Because they may need another piece of paper from you. I don't know. These DME MACs have access numbers for providers. They have numbers that they can call so that they can be provided technical information to resubmit a claim, or in this case, a prior authorization. So I just wanted to kind of add that other layer of complexity there. Now in this last section, I don't want to spend too much time because I want to allow time for Q&A, of course, but I do want to delve into just, put this in context with some of the fraud issues with durable medical equipment that our program at the state sees. And so here we have a list of common types of fraud in this slide number 19. Hopefully you all see it. That's related to DME. So some of it, you can imagine, right? That, or maybe you've seen it or you've heard of it. But these are very common, unfortunately, where suppliers, for example, starting from the top, they offer free equipment, but still bill Medicare, right? They offer people, they say it's free, but at the end of the day, people are, their Medicare numbers are being used and Medicare is being billed. Suppliers use their doctors, not the beneficiaries, to prescribe unnecessary medical equipment. So this is why, having a trusted physician write a prescription is so important. And if you get suppliers that are just using their own doctors without consulting the physician of the Medicare beneficiary, that's a flag. And we've seen that, unfortunately, where it's often this happens telephonically, where they call the Medicare beneficiary and they offer a free back brace. And the person says, okay, sure, why not? And they give their Medicare number out, their Medicare number is compromised. And all of a sudden, the documentation that they send, we've seen it, includes some other doctor's name that the person has never heard of. So these are things that, unfortunately, they're targeting seniors, unfortunately. So the third item, suppliers or doctors provide medical equipment that the person never requested. That's another huge one. And so you can see going through the list, but I wanted to highlight again, back and knee braces are a huge one that we saw a couple of years ago as a trend. It seems to have subsided because Medicare, it seems, has cracked down on this, but not just in our state. I mean, we are a part of a national network, the SMP program, right? Other SMPs in other states, I mean, they were seeing the same wave of DME type fraud issues. The Medicare beneficiaries, literally, they were just being sent boxes of stuff that they never requested. So it's really quite alarming. And it's, it's kind of, the Medicare program is being hemorrhaged, like all of these funds to pay for these fraudulent DME items. So these companies are making tons of money and they're spending the Medicare program's money, right? So even though sometimes the Medicare beneficiary doesn't have to pay for it, it can be a problem for the Medicare program. So I just wanted to highlight that and put it in context. Then the other slide number 20 here, some fraud prevention tips that we like to give is, again, just being sure that the person's doctor has assessed the person's medical condition and orders the equipment. So no strangers. You want to deal with the person's provider. Has to be a trusted physician that can attest to the medical necessity. People really should avoid signing blank pieces of paper from healthcare providers or equipment suppliers. You want to get a copy exactly what are the terms, what is being offered, what does the fine print say. Some of it is intuitive, of course. It's important to review the Medicare summary notice for people who have original Medicare, or explanation of benefits for people who have Medicare Advantage plans. People should, once you review it timely, you can catch errors timely. And then you can call us if you see something like a back brace that you never ordered, or that the person that you're caring for never ordered. Then you can call the Senior Medicare Patrol Program and we can assist and provide support. So I'm not going to read the whole list, but you can see some of these tips that can be definitely important to prevent this type of fraud and abuse that, again, is kind of affecting the Medicare program. We want to save the program for people because, they can get the items that they need, of course. That's the objective. So in terms of the case study, just really quickly, I created a case study that I thought might speak to some of the issues that we hear about with some of the clients that we work with in the SMP program, and address some of the main concepts that we've discussed in this training, right? So I'm just gonna do what I've done in previous trainings, where I'm gonna read the content of the case study and then kind of pose the questions and then kind of walk through some of the responses, and then allow everybody an opportunity to kind of choose the response. And then I will say, feel free in the chat to enter your response in the next slide. And so Miss Archuleta is having trouble getting around her home. She saw a commercial on TV for a handy dandy power wheelchair, and she thinks this could really help her get around her home, right? So she calls the number on the TV commercial, and then a stranger, the representative, right, informs her that he will need her personal information, so including her date of birth, her Medicare number, and her billing address. So Ms. Chuleta feels uneasy about giving out her personal information over the phone to a stranger. So the first question I pose, what should she do? The second question, how can Ms. Chuleta get the DME item that she really needs, right? So in the next slide, we have just a few choices here that we have to choose from. So option A, Miss A should proceed to give out her personal information to the stranger from the TV ad, number to get the power wheelchair. Option B, Miss A should hang up and call her primary care physician's office to discuss her medical need for a power wheelchair. Option C, Miss A should hang up and go to the local supplier down the street to ask about, power wheelchairs. Option D, Miss A should hang up and call the ADRC and request to speak to a state health insurance assistance program or SHIP counselor for assistance with the next steps of getting a power wheelchair. And option E, both B and D, as in David, apply. So I'm going to give everyone maybe a minute to just go through the options, and then feel free in the chat, if you are so inclined to share your response, feel free to kind of participate in that way. And then I will we'll reconvene and go through the best selection. Okay, and at this point, I think I'm gonna kind of reconvene. I think it's been about a minute. I was looking at my phone. Okay, so just kind of going through each, answer here. So option A, Miss A should proceed to give out her personal information to the stranger from the TV ad. Hopefully you see that that is not a very good option here in terms of preventing Medicare fraud. We don't want her to compromise her personal information. A lot of damage can come from her giving her date of birth, her billing address, her home address, and of course her Medicare number to some stranger, right? So we definitely would not advise her to do that. Option B, she should hang up. I like that already. And she should call her primary care physician. That sounds like a really good option. Just hang up, right? And talk to your doctor. I love that. It's just, she should speak to her doctor's office, see if she can speak to her doctor, and, consult with the person that knows her medical condition the best, right? Somebody she trusts. Maybe it's not a primary care physician. Maybe it's an endocrinologist, right? Any trusted physician that she has a relationship with would be a good place to start. Now, option C, she should hang up and go to the local supplier down the street. That again gives me, the heebie-jeebies. I would not want to go to some, supplier down the street, because we don't know if the supplier is a Medicare approved supplier, if they're certified to sell the durable medical equipment item that she wants. And power wheelchairs are expensive. So we want to make sure that she's going to the right place so that Medicare can pay for it. She doesn't want to get stuck with like thousands of dollars. I don't even know. They're probably, over $5,000. So they can be very, very pricey. Option D is in David. Again, Miss A should hang up. I like that. Call the ADRC. I like that as well. And request to speak to the SHIP counselor for assistance about next steps. That would be another good option, because again, it's a power mobility, it's a power wheelchair. There could be prior authorization that's involved, right? She needs to find the right supplier. There's a lot of pieces there that maybe she needs assistance navigating. So both options, B and D, hopefully they're apparent to be the best options here. Starting with their doctor and then calling the ADRC for support would be a good, the ADRC and SHIP program as a good resource. So option E would be the best option for Miss A here. So, and thank you for all of you who included that in the chat, and I will be able, once I exit my slides, I'll be able to see your responses in the chat. And in terms of the SMP, so here I always give a shout out to our SMP volunteers, and I apologize if you can hear my doorbell. I think we had a delivery, so I apologize. So I always give a shout out to our SMP volunteers, SMP/SHIP volunteers, because they assist with both programs. But this is just to kind of highlight some of the things that we do with our volunteers. We couldn't do the work we do. We're only 3 people in the SMP program and just 5 people in the SHIP program at the ADRC. So to get that community education out in different parts of the state, we need the help of folks on the ground that are local leaders that are already, doing some of the work, that are caregiving, et cetera. So I just wanted to kind of give a shout out to our volunteers. And if you're interested in the volunteer program, please, let Dana know, and then, or you can email me as well, or let us know, and we would be more than happy to provide additional information, because we do provide Medicare training for folks who are interested in. Oh, give me one moment. I apologize. I have somebody at the door. I apologize.
This is why I love working from home.
Oh my gosh, I apologize. We're having some work done in our home, so I didn't realize. I apologize. So yes, let me move on to the next slide, because I think I already made that point. And now hopefully my slides will allow me to move. Hopefully you see slide 25. Wonderful. So this is our contact information. So you can see the ADRC number is there. And you can see, you can reach us via phone. You can also reach us via email or web chat. And of course, part of the partnership with New Mexico Caregivers Coalition, if you have complicated issues, I am more than willing to be a contact. So please reach out to Dana if you have a DME issue that you are assisting as a caregiver, or you have your own DME issue through Medicare that you want to discuss and you want to get some assistance, please feel free to contact Dana, and then Dana can provide the information to me, and we can connect in that way. But otherwise, please give out our number, because we help with these types of issues that are complex Medicare issues, as you can see. And then in terms of a survey, I always try to get feedback because we need to improve. We're always trying to improve our presentations and programming. So if you have an opportunity, I welcome you to fill out it takes about 3 to 5 minutes, no more than 5 minutes, just some questions about, kind of what you've learned today and how we can improve. And I would be very appreciative. And I'm sure Dana always helps me send it around post this training, but I will also put it in the chat. And that is it. So with that, I will get out of here. I'm going to stop sharing, and then I'm going to just see if I can exit here and go in the chat. So if there are any questions, please let me know. I'm more than happy to address questions that you may have about the training. I also wanted to give you all resources while you mull over questions. I'm going to start sharing in the chat some resources that I had up that I think froze my computer because I had too many things up. But I'm going to put some stuff up for you.
We had one question that came in during the presentation.
Sure.
Someone was asking about if a shoe lift is considered DME.
Say that again. It's what type of
Would a shoe lift be considered DME?
That is an excellent question. And so for some folks, it could fall into, like, for people, for example, who are diabetics and who have a medical need, that could be under the POS category of durable medical equipment, right? The prosthetics, orthotics, and other supplies. So I'm going to say yes, if the person meets the medical condition, meaning, for example, folks who are diabetic and may have a need or some other type of medical criteria, and they have a prescription from their doctor and they go to the right supplier, a Medicare approved supplier, to get that lift. So that's a shoe lift, right? Yes.
I think that's the only question I saw in the chat so far.
Okay, so let me see if I can pull up some of the material that I wanted to share with all of you that you may find helpful, because I know this is a lot to digest, but I wanted to give you some resources, starting with kind of where you can find, what some useful information that's consumer friendly about durable medical equipment. So my rule of thumb is usually medicareinteractive.org. And I'm going to kind of send you a link here. I'm going to put a link in the chat because I think it's a good place to start. In addition, of course, to medicare.gov. So let me just.
I had a question, Samantha.
Yeah, please.
Would a ramp be covered under Part B or not?
It would not.
Unfortunately,
it would not, right? That's going to be like Medicaid or some other type of program that will cover like home improvements. But again, it's not considered a durable medical equipment item that Medicare would cover. But that's an excellent question.
Then I had another question. So I know you were talking about there's different plans and stuff like that. So you can get like maybe more the generic brands versus the name brands, where you can get your pharmaceuticals. So typically like Walgreens, Walmart, Safeway, are those usually allowed, or would it be more like with the hospital, or does that really depend on the plan that you can get something that's a little bit more accessible?
That's a good question, but typically, so it's important to remember Medicare Advantage plans. So there's a variety of those plans, right? So let me know if I'm understanding your question correctly. So at the heart of your question, I feel like, are you asking if private Medicare Advantage plans, if they will cover the same durable medical equipment items as original Medicare?
Yes.
That's exactly right. They have to. They don't have a choice.
Oh, okay.
They are mandated to. So if we're talking shoe lifts, Medicare Advantage plans have to cover that. So whatever Medicare approved item is covered under original Medicare, private plans will have to cover it. Right? So everything we spoke about, the beds, the wheelchairs, the walkers, etc., all of those items have to fit, as long as they meet the criteria, the definition of durable medical equipment, Medicare Advantage plans will have to cover them. Now, keep in mind, those plans can impose their own rules and cost sharing structures, right? One of the rules, for example, they may tell people, you have to go to our in-network supplier, otherwise we're not paying for it. They can do that, but they can't say, oh, we're not going to cover wheelchairs, they're too expensive. We don't do that. They can't do that. That would be illegal.
Okay, cool.
Yeah.
Okay.
So there's another link that I'm going to put in the chat that I find really interesting. You may find it useful. And it comes from Medicare. It's not, I just want to kind of, it's a long list of items that Medicare does not consider durable medical equipment. And it's really fascinating because it comes from the Medicare National Coverage Determination website. And so this is kind of what we use to research durable medical equipment items like shoe lifts. Are shoe lifts covered? Like I would go into a National Coverage Determination site, look up shoe lifts and see what does Medicare guidance say. But you'll find this interesting because it actually, or maybe I'm a Medicare nerd, so I find this interesting. Maybe others will not. So I'm not going to make it more than it is, but it's essentially a long list. So the list in the slides that you have that includes like what Medicare does not consider durable medical equipment. This is included. So humidifiers, for example, bed lifts, rails, all of those things, Medicare provides explanation about why it's not covered. So if you follow that link, it's this weird website, but it's all Medicare guidance. It's like the rules at the national level that Medicare provides about durable medical equipment, what is considered and what's not. So you might find that list interesting. So I just wanted to put that in the chat just to add more resources, but both Medicare Interactive and, the Medicare.gov is a good resource. So there's another question that came in. Let me see just before. So from Karen, I have a question. If the doctor wants home physical therapy, will that be under Medicare? Yeah, so that's an excellent question. And it touches on durable medical equipment in an interesting way. So if the person has Medicare and they have some other insurance, Medicare, if the primary insurance is Medicare, then the physical therapy services that the doctor is ordering should be covered by Medicare, right? The person will need a prescription. They're going to need to have a medical need for the physical therapy in the home. All of that criteria in order to receive home health care benefits has to be, the person has to have all of that. But, in addition to that, for example, if the person is receiving the home health care benefit, they're receiving physical therapy, maybe they're receiving nursing services or something else, Medicare under the home health care benefit may also cover durable medical equipment. Catheters, for example, may be covered under, the POS category of durable medical equipment, especially for folks who have a medical need, right? And they're in the home and they're receiving home health care benefits. So that's an interesting question. And I would say, yeah, Medicare will definitely cover it. But again, people have to meet the criteria for coverage. They have to have the prescription from the doctor. And so hopefully I addressed that question in very broad brushstrokes. And then there's another question from Agnes. Medicaid did not cover my son's shoe lift. I hope that Medicare will. So my question would be, why did Medicaid not cover the shoe lift, right? We would want to know why was that a denial, because that's important. And then in terms of Medicare, it's going to be important again to meet the criteria for coverage. So having the doctor's prescription for the shoe lift, going to the right supplier is going to be very, very important to ensure that Medicare will cover this item. That's the goal at the end of the day, right? But yeah, Medicare, but again, there are no guarantees with Medicare, but we have to understand why denials happen, because that Medicare tells us, I'm not covering this because maybe you didn't have the documentation, right? So we have to understand, well, why did Medicare not cover this? And the same with Medicaid, I would say, why did Medicaid not cover this? There has to be a reason that they give so that we can do something about it, right? As advocates and as caregivers. And then let's see. Oh, wonderful. I'm so glad I answered your question, Karen. These are excellent questions. And I think they touch on the more of the complexity of dealing with these types of DME. DME is probably one of the most complicated pieces of Medicare, of the Medicare structure, but it sounds like from these questions, you're asking the complicated questions. So I'm hoping I didn't completely confuse everyone on this call. But all I can say is there's definitely resources. And
if somebody wanted to really kind of get more in the weeds, they can make an appointment with you, right?
Yeah, definitely. I'd be more than happy to speak with any one of you if you want, if you have a specific case or issue that you're dealing with. I would be more than happy to provide more guidance if I can, and then connect you if it is a DME issue that you need more assistance with to one of our SHIP counselors, or with one of our SMP staff members if it's concerning a billing issue that Medicare didn't pay for something, or it's a fraud issue. We would be more than happy to support. There's another question here coming from, I think it's Nola. I apologize if I'm not seeing the full name here. Would you please email the resources to me, as I do not know how to access the chat after the meeting? Yes, I think I'm going to send a list to Dana with some of the Medicare Interactive link, and of course the CMS, the National Coverage Determination website. information as well, and some of the other useful resources that I haven't included in the chat, but I will be sure to email those
Yeah,
to Dana. And then
I will send them out after probably tomorrow.
Wonderful.
Follow-up email with all of Samantha's links and the link to the survey in case you didn't have a chance to complete it. But to point out that this survey is specific to Samantha and her organization. It is different than the survey that I and Valerie have been asking you to complete, just so there's no confusion there.
Wonderful. Any other questions? Okay, it looks like it's all quiet.
Well, if there are no other questions, thank you all for joining us. Thank you for being patient with our tech issues today. That's the problem with technology. Sometimes it's great and goes perfect, and other times every possible thing goes wrong, but thank you for your patience. I hope everyone found today's session really informative. Thank you all for joining us. Thank you, Samantha, for another great presentation. And we hope to see you in another class soon. If you were recruited and brought to this program by Valerie, make sure you follow up with her after today's class. She'll help you get your post surveys submitted. And if there are any questions that come up after we end, feel free to email me or Valerie, and we can make sure to get them to Samantha and help get you some answers. So thank you very much. I hope everyone has a great rest of your Thursday.
Thank you so much, everyone. Be well. Take care.
Have a good afternoon, everybody.